The Honourable Member for Pomio.
Thank you, Mr. Deputy Speaker. On this side, would like to support the statement made by the Minister for Health today. It's very, very important. Health is an important concern for all of us. Health, all our members must take ownership of the health of our own people and making sure that we comply with the National Department of Health standards and other things. So, thank you, Minister. He presented his 100 days plan, which is about 18 months plan for what we'll be doing for health sector in our country. We can say that the health is an ongoing challenge, and we will from this side will support what the government is doing. It's an ongoing challenge, but we will make sure that we try our best to support the interventions that he has put forward. First is we are happy to hear about the review on the Provincial Health Authorities Act of 2007. I kept saying that it's an important area that we need to look at, but especially the regulation that specifically specified section I think 56 or 57 that talks about the regulation of PHA Act. It's an outstanding matter that needs to be addressed. At the moment, we have the chairmen of the PHA board who do not have any clear communication direction, or how do they report or they interact with the governor of the provinces. And something where not very clear at the moment. So something where he need to look him clear. The Minister of Health want them Secretary Blongem, he must need him clear communication. Want them Chairman Blong PHA board. Na CEO of PHA, something clear to us, which we believe that if we see or we can improve that in the regulation, which specifically required long Section 57 of PHA Act. We were with the Department of Health, and we were discussing this, but we'd like to see if the minister can actually come forward and let us know whether this is being done or not. Secondly, I'd like to support the government in the position to say that all our LLCs in Muscat health center, now got the districts in Muscat district hospitals, now got the province in Muscat on the provincial housing. That's why we be in health standards. Me like making sla tuk tuk na support him, and I give him like example come back long NCD national capital district. I may ask him also today you serve all district the districts that we make at low NCD, you may serve all district housing blow stop low way. You may ask him the question, we do not know where the district hospitals are. If we say that the Gary Hospital is the provincial hospital for NCD, it does not meet the standard. It doesn't meet the standard for level 5 for a provincial hospital, We acknowledge the fact that there are many specialized SMOs or medical officers now only stop work Gary stop. They're actually wasting the manpower skills there. Plant line through all staff up, now no fully utilizing skills belong all. Plant surgeons all staff up. Plant logman way only trade go through all staff up. Now they actually wasted some manpower there. So me ask him how good the team from the PHA team work one time Department of Health now. Get the systems in order. Get the NCD health system actually. Maybe Minister of Health now even though it's actually chaotic. Because if we go to PMGH now, as you speak now, today, Omla specialist, Omla Dr. Lab me describing situation, the PMGH at the emergency department, the outpatient department also, it's like a war zone. It's like a war zone. Now, PMGH is supposed to be a national referral hospital. Now, we must shift teams, let's start to look at specialized skills or specialized areas like kidney, transplant and looking at now somebody, the CEO is coming up with a very good facility like addressing cancer, which are actually killing thousands of our citizens every year in our country. Now we look at this all the specific areas. Now they are now still burdened and bombarded with many of our people with all really sick, all really headband or really scratch or really body. The hospital that comes into their mind is PMGH. The PMGH is supposed to be addressing only the referral cases going through the system. So as I think the good CEO, Dr. Molome, is doing his best, But I actually had a meeting with some of our doctors there, although they actually stressed out. Stressed out because the NCD health services that need to have their own district hospitals, where all sick man almost go to slap past them, and then I'll receive referral letter and I go to PMGH. That's not happening. So I call on the PHA team of the NCD to have all our systems in order so that we can relieve the burden that is now at the PMGH CEO, the hospital staff there. Now we focus on providing this good service where they're supposed to providing as a level 6 super specialist training hospital for country. Suppose this come up, and by still we can talk about the health, the cancer facilities. We now have a very good system of the heart facility now there, where before online we got the blockage long arteries, heart, all can go long Australia. But now I can say that they are now doing it at PMGH, and we want to go down this path. We want to go down this path. We need to talk about the new interventions of healthcare in our country, and we need to allow PMGH to actually be relieved of this. Now let them concentrate on what they can do, addressing the overall healthcare. So, we support him. Our good minister is doing very, very well. In terms of health, we are with you. We are supporting you in every aspect of what you're doing. But let's address some of these things. I again call upon the team from NCD PHA to see what they need to do. Coming back to the central province must have their own hospital. The Gulf province must have their own hospital. All of these things, they also come to PMGH and giving unnecessary pressure. Me believe also on behalf of PMGH CEO na Samuel Kuplo, Dr. Spluimi, we only come looking at the side na talk about this or something. Me asking also, let's address all these things so that again PMGH is given that rightful the opportunity to try to address the important things that they can do as a level 7 National Referral Hospital, so level 6 National Referral Hospital. Thank you, Mr. Deputy Speaker.